Hi everyone, this is Dr. Brad Smith. I'm the medical director here at Rogers Behavioral Health in Oconomowoc, Wisconsin, which is our original site for Rogers Behavioral Health. I wanted to talk with you a little bit today about the concept of resilience. You know, all of us have been affected to one degree or another by the COVID virus and the restrictions that are taking place in our communities for our safekeeping and the safekeeping of others. And this whole pandemic and the changes that have happened in all of our lives have really brought this concept of resilience to the forefront for me. This is an area of study in the field of mental health that has really interested me over the last several years because I think it applies so much to our individuals who have struggled with mental health challenges in the concept of not just treating symptoms or changing things for today, but improving somebody's mental health abilities and their resilience for the long term to hopefully keep people well long after they've tackled the original acute symptoms that they're dealing with. So this is an area of study that has been gaining speed and gaining evidence in the mental health field. And I think it's very applicable to what we're all challenged with currently with the changes in our lives related to COVID-19. So let me talk a little bit about where this concept stems from. You know, there are many things in our lives that create challenges, and some of them are much more challenging or traumatic than others. And it's based on the observation that some individuals who face extreme challenges or extreme traumas have proven to be very resilient and have had the ability to move forward in their lives in ways that some of the rest of us have not been able to. So there's been increasing study, for example, about why do some people who face the same traumas as another person go on to have significant symptoms and disabilities such as post-traumatic stress disorder, while others seem to be able to move past the event and function in their lives without being affected by those same symptoms. Well, those and other questions have led to this study of the concept of resilience. What I'd like to do is share with you a couple of the more common themes or more common traits that come up as it relates to resilience. And the reason that we look at these traits is because it's not just to point out who has them and who doesn't, but because most of these traits are things that we can all work on. None of us are going to be blessed with each of these characteristics or to have high degrees of resilience in every single category. And what we've learned is that many of these characteristics are things that we can strengthen and that we can work on so that we can become more resilient. The first place I'd like to start is in the concept of optimism. Optimism is a very common characteristic among people who are resilient. What I think is important to know about this is that this is not the type of blind optimism of somebody who's naive to their circumstances or unaware of what's happening around them, but we think of it as realistic optimism. So someone is aware of the situation they're in, and yet they're choosing to look for opportunities to find the optimism. And some of the ways that we work on optimism have to do with using some of the basic concepts of cognitive behavior therapy, which is one of the types of therapies that we focus on here at Rogers and that are focused on in many other places that treat people with mental health issues. People who naturally are resilient tend to be able to find ways of putting things in perspective, even very traumatic or challenging situations. And we work in cognitive behavior therapy to literally start challenging negative or pessimistic thoughts, similar to the way we might with someone who has depression, where once that illness starts, it tends to cause ruminations about negative thoughts, and we work very hard then to reverse that trend to have more positive thoughts playing in the person's mind. Another way we can work on this is through the behavior change that is also part of cognitive behavior therapy. And so by behavior change, what I'm actually referring to in our situation currently, where many of us have had to have a very different change in our lifestyle and change in our culture, is trying to find the behavioral patterns that will allow us to have better thoughts about the situation. So most of us have faced a very significant change in what we need to do in our daily lives with the quarantines and the restrictions placed on social gatherings. Well, we can certainly choose to look at that in the most negative ways, but people who are naturally optimistic might start to look for ways to find the positives in this, or at least to be able to tolerate it better. And one of those ways would be through trying to set up our behaviors and our schedules to try to make sure that we're putting ourselves in the best situations to not get depressed or to not get anxious. So we set up our schedules to try to make sure we're engaging in activities that we know are enjoyable for us, activities that we know will help bring us purpose and meaning to each day, and trying to make sure that we continue to have that sort of structure in our lives so that we don't slip into isolation or depression or anxiety. One of the most helpful ways to arrive at optimism is to work on gratitude. Once again, some of us are more naturally grateful for things than others, but this is certainly a concept we can work on. And we can work on this through taking time to list the things we're grateful for. We can take the time to try to reach out to people that we know we have gratitude towards and connect with them, and work on ways to make sure that we're taking stock of all of the great things that are a part of our lives as one of the ways to try to offset some of the very real and difficult changes that we're all facing. The next concept I wanted to talk about as it relates to resilience is the concept of social support. One of the things I think of in terms of social support is how difficult that is when we're told to socially distance ourselves and to isolate ourselves in our home. And on the other hand, this is the one time in history where we are the most prepared to be able to stay connected to other people and to our community than any other time in history when we've faced these types of quarantines or isolations. We've had a lot of negative press and a lot of good study about the negative effects of social media, about screen time, and the effects these things can have, the negative effects they can have on mental health. This is our opportunity to try to utilize those platforms in the most positive ways, and really probably the ways they were intended in the first place, to allow social connection, to allow a sense of community, for us to be able to reach out to people who are otherwise not as easy to reach. Another area of social support would be the changes that we're all making in our households. There is going to be a significant need for members of the same household to develop connections, maybe where those connections have been severed in the past, or maybe where those connections have not been as strong as we would like. But this is a time to reconnect or to strengthen connections within our own households. These are the ways that we maintain social support. It's the way that we survive. It's the way that we remain resilient. And I think of countless examples through history where people have been faced with these types of challenges, whether it's a virus pandemic or whether it's a world war, where our social connectedness has been what has allowed people to persevere and to remain resilient. One of the ways I think that we can do that now is, as we're seeing around the country, people are taking this opportunity to be more connected with their community. This is a cause, and people can give in terms of financial resources. People can give in terms of their time and talents. We have people around the country trying to help procure supplies for protective equipment for medical personnel. We have people around the country raising money for individuals and families affected by the pandemic. So there's no greater way to be connected to our community than to look at ways we can be altruistic and to help with this cause. So again, social support is one of the main pillars of being resilient. And so I encourage us all to engage in whatever methods possible to remain connected to our communities, connected to our households, connected to our friends and family. Another concept that I think is important to cite when it comes to resilience is the concept of spirituality and religion. This comes up frequently in studies about resilience, and some sort of connection to a higher power, some sort of connection to the world and how you feel philosophically of how you fit in the world, some sort of spiritual connection or religious connection tends to make the challenges and the traumas of our world more tolerable. So spirituality and religion mean different things to different people, and this is a time to explore that as a way to be resilient. Explore what your own spirituality and religion means to you through meditation, through prayer, through gathering via technology with individuals who have other similar thoughts and beliefs, or reaching out to look at other thoughts and beliefs to see if something resonates for you, to help you feel connected to something in the world or outside of this world. There are various types of meditation techniques that do not have to take a religious form. There are numerous ways of introducing yourself to meditation through mindfulness meditation, through various other types of meditation. Numerous apps are available to try to help with this. Some way to find a meditative way for you to become more spiritually in tune, religiously in tune with your beliefs, and to be allowing this to be another way to be connected to our community and to our friends, family, households. Another concept related to resilience involves having a sense of purpose, having a sense of meaning in each day. In the worst of circumstances, the people who have persevered these have talked about trying to have some sense of purpose. Viktor Frankl, a survivor of Auschwitz, who happened to be a psychiatrist, wrote about man's search for meaning and saying that it is really about that search for meaning that allows us to go on. And how we can practice that is by finding ways to make this meaningful for us in some sort of positive way. Let it be the way that you connect again with your community. Let it be the way that you discover altruism or charity. Let it be the way that you discover spirituality or religion for the first time or reconnect to it. Let it be the way that we learn that we are all equal, that a virus does not know race, color, socioeconomic status, that we are all human beings connected to one another. And if we allow this to give us meaning and give us purpose by the things that we do each day, we will be able to have a more resilient outlook on this situation, as well as many other challenges or events in our lives. I think the other concept about resilience I want to mention is the importance of physical and mental activity or exercise. And certainly if you have been affected by the virus in a more substantial way and you're suffering from more symptoms of this illness, it's going to be challenging. For others, this is an opportunity to try to remain healthy physically and mentally, both for now, but it may serve as a way for us to become healthier long term. In a very ironic way, that an illness and a disease like this may turn out to help us be healthier in the long term if we make lifestyle changes to try to help us through this time, which could also help us long term. Physical activity and exercise has long been known as a great stress relief. It's long been known as a great health benefit. And this is a time where we need to try to keep our bodies as healthy as possible as we try to have proper immune systems, as we try to have proper stress relief, as we try to be able to continue to concentrate and focus on what we need to do. Exercise is known to help our brain activity. Exercise helps our heart, our lungs. It helps our immune system. So staying physically active is a part of trying to be prepared for this pandemic and trying to continue to persevere through it. Mental activities, mental exercises are a part of staying healthy ourselves. We've already talked about a number of ways of trying to put new things into practice to be more resilient. All of those would be included here in terms of mental activities or mental exercises to become resilient. I might just add that the more that we feel like we are allowing ourselves to do our enjoyable activities, the more that we feel like we are engaging ourselves in purposeful, meaningful activity, the more that our brains and our minds are going to feel nourished and the more that they're going to feel healthy. So we want to keep our brains and our physical bodies healthy as long as we can, as well as we can through this process. But they also may be lifestyle changes for our physical health and our mental health that can help us through the rest of our lives. As I mentioned at the beginning, this concept of resilience is something that had been a strong interest of mine well before this pandemic because it relates so closely with the challenges that many of us face in terms of mental health issues, mental illness, and the recovery process. It relates to us in terms of how to stay mentally healthy in the face of adversity, in the face of trauma, and it creates a new paradigm of mental health treatment where we're not just looking at treating immediate symptoms, but the concept of resilience allows us to talk more about trying to stay healthy mentally. This applies so poignantly to our current time, where all of us have been faced with some level of challenge as it relates to the pandemic. But these sort of changes and health behaviors that you create in relation to this acute need right now will likely help you in further challenges and further times of need in the future. So I encourage you to practice at least some of these areas to strengthen your resilience and allow this to help you not only now, but for the rest of our lives in terms of being more resilient in the face of challenges.